Hi, I'm Dr. Kristine Grdinovac. I am an endocrinologist at the University of Kansas Medical Center, and I am the director of our Cray Diabetes Center for Self-Management. This is our research in different types of intermittent fasting and intermittent energy time-restricted eating in reducing medication burden in patients with type 2 diabetes mellitus. And so the primary researcher and the brains behind this program is Dr. Felicia Steger. She couldn't be here right now, so I'm stepping in for her, but this is her project. And so we've also worked with other physicians and PhDs at the University of Kansas Medical Center, and they're listed up here. So we were looking at remission rates in patients with type 2 diabetes, and we put them to two different programs. We looked at how they responded to both intermittent energy restriction and time-restricted eating. And so intermittent energy restriction, we ask the patients to have a very low calorie diet for 2 to 3 days per week, and then otherwise eat healthy. Our time-restricted eating group had an 8-hour window with which they were eating during the day. And again, eating healthy. These patients also had group classes and a lot of educational material on nutrition to be able to have that kind of support. And there were several phases in the program where they had more intensive intervention and then less intensive intervention. What this poster shows is that we were able to de-intensify or eliminate medication burden for a significant proportion of our patients. At the beginning of the study, almost everybody was taking some sort of medicine for diabetes. And then at 6 and 12 months, regardless of what group we had, we were able to have 17% of our patients stop medications entirely. I'm sorry, 24% of our patients reduced medications entirely, and 2/3 of our patients were able to at least reduce medications somewhat. And we were able to achieve also a 14% remission rate in type 2 diabetes mellitus. So you can see here that all of our patients, most of our patients at least reduce some of their medications. And so this really shows how behavioral health, intermittent energy restriction, time-restricted eating, and this kind of supportive care can really improve patients' lives with type 2 diabetes mellitus and even reduce their medications or induce diabetes remission.